It's almost time to go for a Q6 treatment. That's almost one. So we should be getting ready to go there, okay? Oh, wait a moment, please. I've just received a payment to come to the ER. So I will join you in a while. You can start from the third floor to give treatment, but make sure you check patient ID, pulse, respiratory rate before you can give any treatment, because most often they can change patient from one room to the other.
Okay, I got it.
I'm gonna go to the ER now. I hope you remember all I told you, what I'm supposed to do. Now.
Got it. Don't worry. Alright. B106, Mr. Gonzalez. Alright. I wonder why the lights are from the first place. Oh well. Okay. Chart. I've already checked that. Hi, sweetie. I'm here to give you your breathing treatment, and let me just check your breath sounds really quick and see how those are doing. A little bit diminished. Clear, but diminished, I'd say. Let me just get your heart rate before we get the treatment going. Let me check this side. Okay. So let's see, 8 times 10, got a pulse of 80, and we'll see respirations of 16. Now let's get your treatment going. So let's just put this in your mouth and take some nice big deep. I need you to open up for me, sweetie. Okay, that should work. Oh, well, let's see. There we go. Darn it, I guess I'm just gonna have to put the cap on. You're not being very cooperative. Are you still a little sleepy this morning, sweetie? So I guess I'll just have to hold it here for you. It's alright. Oh, hey! Look at that light. She's coming on with the camera. She's gonna make it so right now. She's gonna sway this one too. Oh man, a commercial again? No, well, I guess we can be done with this. Oh, and looks like your oxygen's off. Let me turn that on for you. There you go, honey. I bet that helps. All right. Well, it's a good thing I came in because your breath sounds were a little diminished, and I'll be back in about 4 hours to give you another treatment. All right? You take care. Oh, that's right. What was that? Always leave the patient how you found them. So let me just put this back up over how I found him. All right, sweetie, I'll be back in a little bit for another treatment. So, which patient do I need to do next?
What are you doing in that room?
Oh, I just got done giving Mr. Gonzalez breathing treatment.
Mr. Gonzalez?
Yes.
Don't you know he passed away some 3 hours ago? When you get into a patient's room, be sure you introduce yourself formally. Let the patient know the department you come from, respiratory, as a student, why you are there, and the type of treatment you are going to give to the patient. This helps to reassure the patient. Now, from the video, you now see what is the correct thing to do. The student started by knocking on the door. Introduce herself to the patient. Review the chart to make sure that the order is proper.
Yeah?
Hi, Mr. Serrano.
Hi, how are you doing?
Good, how are you?
Not bad, just having difficulty breathing. It's when I'm sleeping, usually when I'm laying down or when I'm up.
So having some hard time breathing. Well, my name's Christy. I'm with Respiratory. So I'm here to give you a breathing treatment today and see how your breathing's doing. If I could just check your name band. And can you verify your birth date with me?
Yep, that's it.
Look at your armband.
It's 152768.
Okay. I'm just going to check your chart and verify your order before I give you your treatments. And let's see. So today's date is the 24th, and looks like you have an order for a handheld nebulizer with albuterol, 2.5 milligrams with 3 milliliters of normal saline. You got Q4 hours and as needed for shortness of breath or wheezing, which you have stated that you are having.
So I don't need the other treatment too? Just that one is supposed to get?
Well, you'll be getting them every 4 hours. So, and then if in between, if you feel like you're having a hard time breathing, like severely, you can go ahead and contact your nurse and she'll call me and I'll get right over to help you.
Okay.
Okay?
Okay, I'm ready.
Checked the vital signs. Listen to breath sounds before treatment and as well as after treatment. For the breath sounds, you make sure you listen to the all lung fills. If the patient is alert, you can also listen to the back of the patient. That will help you to determine exactly what the lung sound is like, not just hurriedly listening to one part of the lungs and leaving out the other parts.
Okay, so I'm just going to check your breath sounds and see how your breath sounds.
Oh, okay.
And then what's going on in your lungs. Okay, so take a couple nice big deep breaths in for me. Okay, great.
For the vital signs, you noticed that the student checked the pulse for 15 seconds and the respiratory rate for 30 seconds.
Can I go ahead and check your pulse really quick before I get started?
What you mean?
I'll go ahead and do this one right here. So 20 times 4 gives me a heart rate of 80, and then 8 times 2 gives me a respiratory rate of 16. And breath sounds were slightly decent.
That was about 20.
16.
Okay.
I need to emphasize here, inasmuch as it is good for you to be friendly to your patient, avoid being too personal with these patients. It can lead you into trouble. Avoid using words like honey, sweetie. Be official, but also be friendly and polite. Once you are in the patient's room, you are there only for the patient. The patient needs your rapt attention. They are watching you, seeing what you are doing. Pay attention to them. Don't be carried away by the things you see in the room. Like in the video you watched, you noticed that the student was watching the television in the room instead of paying attention to the patient she was attending to. You will notice that most of these therapists you'll be working with carry whole lots of meds for different patients in their pocket. It is your duty to verify that the meds they give to you to give to any patient is the particular and appropriate medication for the patient involved.
Have you ever had breathing treatment before?
I have, but not that one.
Well, basically with this one, how it works is it basically just works when you inhale. So it actually distributes the medicine better and gets it further down into your lungs for you. So just go ahead and just take some nice, slow, big deep breaths in for me.
Okay.
There you go.
How often do I do that? All the time? So it's gone? Or?
Hold on. That will run for about 15-20 minutes. Nice and slow. You don't want to make yourself lightheaded.
Is that normal?
Working. Yeah,
Oh, okay.
medicine's getting down in there. Okay, Mr. Sorrow.
Sorry, it was an episode there.
Sorry, I'm just gonna. I know it feels a little funny, but just bear with me, okay? Because this is what you need to help. It will kind of ease the work of breathing.
Sorry.
Okay, I need you to hold still for me, Mr. Serna.
Oh!
I'm sorry, sir. I know it's not the most comfortable thing, but it's going to get you well so you can get back home to your loved ones.
Are you a student?
As a matter of fact, I am.
Oh, cool.
Am I doing an okay job for you?
That's
Okay, great.
so far.
Great. All right, well, do you want me to leave you sitting in your seat for a little bit?
Yeah, you can. Yeah.
All right, and then I'll call you back in about 4 hours, about 2 o'clock, to give you another breathing treatment, all right?
Okay.
All right.